Respiratory Syncytial Virus, or RSV, is the most common virus that causes the common cold. It occurs in all ages, and in fact almost every human has come into contact with it by the age of 2 years. After you've had it once, we don't actually develop immunity to it, which means you can keep getting it again and again. It is very infectious, and kids tend to spread it because their hands are frequently touching surfaces and going into their mouths. After exposure, it's usually 5 days later that you begin to see the symptoms. Fever, cough, sneezing, wheeze. The entire episode, it typically lasts around 10 days, and your child is infectious, meaning they can pass it on, for a total of 8 days from the beginning of their symptoms. For most people, RSV causes very mild symptoms. These will respond to rest, hydration, pain relief, and seldom do you need much more than that. But RSV can get a little bit more troublesome at times. It can trigger asthma episodes in some kids, also croup, and if your child is under the age of 1, RSV has the potential to cause bronchiolitis or pneumonia. These are lower respiratory problems, deeper in the lungs, and your child will need to be reviewed by a doctor. So when do you, when don't you? Well, generally speaking, it's important to have your child seen by a doctor if 1, they're sick and they've got an underlying health problem. 2, if their fever is very high or they look particularly flat, lethargic, unwell. 3, if they have such a blocked nose that it impairs their feeding. Or 4, if they're starting to cough up mucus, if they're really working hard to breathe. 5, if they're beginning to get dehydrated. And 6, always have a child reviewed by a doctor if they're sick and under 3 months of age. Once the coughing and sneezing has stopped, your child can return to school or daycare.